It has been proven that bystander CPR improves the rate of survival by almost 50%. Save a Life is an initiative through which people will be made aware of the early signs and symptoms of cardiac arrest so that patients can get to the hospital in time and also be trained on giving CPR if the need arises. Today we have with us eminent cardiologists who can help you understand sudden cardiac death as well as the role of CPR to revive and save a life. Thank you so much, doctors, for joining us. We're joined by Dr. Ankur Fatarpekar, Director, Cath Lab Symbiosis Specialty Hospital, Mumbai. Dr. Priya Palimkar, Interventional Cardiologist, Sahyadri Hospital, Nagar Road, Pune. And Dr. Sumitra Kumar, Professor and HOD Cardiology, Vivekananda Institute of Medical Sciences, Kolkata. Thank you so much for joining us and talking about this issue around which there needs to be a lot more awareness in the country. Now, Dr. Ankur, I'd like to start with you. What is a coronary artery disease, and can coronary artery disease lead to sudden cardiac arrest?
Hi, Gargi. Thank you for having me here. And let's first understand what coronary arteries are. So basically, heart also requires blood supply. So the arteries supplying the heart are called as coronary arteries. Any buildup of cholesterol in these arteries leads to narrowing of the lumen of these arteries. So there might be two presentations how this buildup might show up. First is a slow buildup from say a 20, 30, 40, 50% going on to 90% might present with a very stable presentation. That means the patient might get chest pain while walking for 5 minutes. The other presentation is maybe the blockages are not significant. Maybe it's a 40, 50% block. But suddenly, because of the buildup of the cholesterol, there is rupture of this plaque. And when it ruptures, it takes a clot along with it. So say a 40, 50% block becomes a 100% block because of the clot, say in 5 minutes. 5 minutes back, the patient was absolutely normal, and suddenly he gets this chest pain. And because of the 100% blockage happening there, the blood supply to the heart goes down, and because of that, the patient gets a heart attack. There are two consequences of this heart attack. One, as you know, the heart is a pump, and heart and lungs are connected. So what happens, the heart does not pump the blood out, and because of this, all the blood dams back in your lungs, and the patient starts feeling breathless. This is called as heart failure. The other presentation is devastating, and it's called as cardiac arrest. What essentially happens in a cardiac arrest is because of this 100% block, there are bad rhythms which are happening in the heart. That means the heart rate might go very fast, giving rise to ventricular tachycardia or ventricular fibrillation, or go very slow, which is called as complete heart block. And this leads to stoppage of the working of the heart, and this is called as cardiac arrest.
Now, Dr. Ankur, lack of CPR awareness is a big health challenge in India. Can you please explain the need and role of CPR in saving a life of a person who suffered a cardiac arrest, and how we need more people to be trained with this?
So, Gargi, let me tell you, it's a very basic life support skill. Just like how you would survive if you know swimming. In the same way, giving a good CPR helps save a life. So that's the first thing. Second, CPR term is very self-explanatory. It's cardiac pulmonary resuscitation. So that means the heart and the lungs are resuscitated or restarted when the patient has a cardiac arrest. A good quality bystander CPR saves lives. To give you some statistics, almost 3 lakh cardiac arrests happen all over the country, and out of which around 70% happen in the homes, 20% happens in public places, and 10% around in the hospitals. So you can see the need for CPR in amongst the general population. Going further, 40% of people who would have been dead survive if they are given a good quality CPR. Imagine the benefit which it would give to the general population. Also, the other thing with CPR is also the presence of AEDs. AED present, if it's present, it helps give shock and revert the bad rhythms to a normal rhythm of the heart. So that is also very important. Now, coming about awareness and how to go about, I think it should be taught in schools. We taught a lot of things in schools, but something as important as CPR is still away from from being taught in the schools. So CPR should be taught in the schools, and not only that, but also how to give a CPR should be reinforced at fixed intervals of time. That means people who have learned CPR might forget it because they are not doing it regularly. So reinforcement of CPR skills is also very, very important.
Life, and we're talking about CPR and the importance of recognizing heart disease. Let's go across to the doctors with more questions. And Dr. Ankur, what if a person with an ICD or a pacemaker gets a cardiac arrest? Then can we perform CPR on such patients?
A very good question, because a lot of patients have pacemakers, and this is always a question which their relatives would ask, is whether can we perform a CPR or with an IED also. What is essentially a pacemaker and IED? Let me explain to you. A pacemaker is a device to increase the slow heart rate of the heart. So people who have slow heart rates, it is a device to improve it. The AICD is basically a device which shocks these fast heart rates and gets it to the normal rhythm. Now, what happens with the patient with the pacemaker? It is simple. You do it like a regular CPR. The same thing which Dr. Palamkar told you is the same thing you do. But what happens with the patient with IED is sometimes, because the patient goes into cardiac arrest, the machine might be charging and giving shocks internally. So it's very important that you recognize when the patient's body is moving, that is the time when he's receiving the shocks. So if you're doing CPR in such a patient, it is better that you wear gloves yourself and also shoes down below, and continue in the same way once the shock is delivered by the machine. Now, when it comes to using AEDs, it is important that we stay away from the pacemaker and the AICD side. So it should be at a sufficient distance below where you attach the AED pads. So these are important things when you have a pacemaker and an AICD in place in patients.
Cholesterol, is there a link between dietary cholesterol and heart disease?
So cholesterol is very important part in the pathophysiology of heart diseases. So diet definitely plays a role, but it's not the complete story. So many a times patients who are diabetics or patients who have familial tendencies of having high cholesterol, they might have inherent tendencies to have more cholesterol in their body. So just a dietary modification might not sometimes help in these individuals. So you have to go beyond diet. So it's exercise, diet, and sometimes you might have to take medications. And also it's very important to know that whenever you do your cholesterol reports, any reference range which is seen, it's for the general population. So diabetics and patients who have cardiac issues, the cholesterol has to be kept much, much lower than what it is. So it is very important that we don't get this inertia, or what is called as therapeutic inertia, wherein we just maintain our cholesterol, try to maintain our cholesterol by doing just a dietary change, but not bringing it down to levels which are actually needed and recommended.